from Cumbria, Northumberland and Tyne and Wear NHS Foundation Trust, who will give their experiences of the challenges they've faced. I'll now hand over to Stephen.
Thanks very much, Sue. And
Steve, I think you might have muted yourself.
I think you were right. Sorry about that. Can you hear me now?
Yeah, we can.
Yep. Okay. Sorry about that. Yeah, so starting again. Thank you everyone for joining in today, and a special thank you to Royal College of Psychiatrists and to the CCQI, and especially to the exercise professionals that have given up their time to give you their insight into how they've coped through this time.
Steve, I think you've muted yourself again.
Sorry, I'm having some issues here now, typically, with this. So as long, am I back?
Yeah.
Yeah, sorry. Okay, so the aims of today, just to introduce you to who the Exercise Professionals for Mental Health Network is, and just give you a bit of awareness around the role of qualified exercise professionals in mental health care. Raise awareness to the importance of physical activity and exercise in people's care pathways, and understand how there's additional challenges at the moment, but especially within secure settings and PICU services. We will then also, for the main part that I really want to get to, so I won't speak too long hopefully, is look at the examples from the exercise professionals we've got online today, and a few people that have sent some examples through to me, to show you their challenges, how they've adapted and how they've continued to engage our service users and staff with physical activity opportunities. We also hope that this gives you some ideas and supports you about how you can improve the facilitation of physical activity and exercise during this time, but also looking forwards how this can maybe be a real opportunity through this time to create a new culture around physical activity and exercise to continue that as we come through this time. So just quickly, what and who is the EPMH network? We established the network in 2018. We're a voluntary organisation, and much of the work is done in our own time around our clinical responsibilities. We set this up mainly because we knew there was a lot of exercise professionals working in mental health care, but there was no organisation to bring us together and be able to share ideas, share practice. And it started off with visiting a few different sites and learning from other services. But then we also agreed we're all facing a lot of the same challenges. So we came up with some main aims of what we wanted to achieve by setting up a network around ensuring exercise and physical activity is offered at the core of people's care, and not just seen as a nice addition where possible. We wanted to establish standards and guidelines, which is a real problem. If we don't have that, then there's no reason for actually exercise to be put into services. There's no real conditions for that, even though we know all the evidence and the benefits of it. So we want to establish some standards and guidelines, and we're slowly working towards that. And that's two reasons. One, for trust to be able to follow, to ensure that people are accessing those interventions, but also for the exercise professionals themselves to make sure we're working in a safe, effective and evidence-based practice. We want to raise the awareness of the benefits of exercise and physical exercise on physical and mental health, and also raise the awareness of what the role of a qualified exercise professional is. I think that's a lot of people won't really understand what we do, or why we do it, and what we can actually be asked to do. There's a lot of skills out there. So I'm going to touch slightly on some of those things, but like I say, this is more about giving you examples today. But if anyone wants any more information, please feel free to contact us. And just to give you a bit of an update of where we've got to, we've had two national conferences now, which has been attended by over 200 people in total. We had a shared practice day, and we were due to have one just the other week in Devon, but unfortunately because of the climate at the moment we weren't able to do that, but we will hope to do that later in the year. Some other things, we've been very lucky. Again, the Royal College of Psychiatrists have been really supportive of what we try to do, and we've done a couple of bits of work with them in presentations, and we're invited by NHS England to lead on the physical activity stream for the Achieving Healthy Weight guidelines for secure services. Some other exciting things that have started to happen, Australia and New Zealand, we've had contacts with people out there, and they're setting up their own networks out there, and Ireland are also setting up their own one and hoping to launch that in the next week or two. So really exciting that it's actually something that's being seen around the world that's important at the moment to get exercise into mental health. One thing about the qualifications of the exercise professional that I mentioned, I think it's just important to emphasise one of the main reasons we're in our role to do exercises from the training that we've had and completed. You need to make sure that it's accredited training that's adequate for people to work and prescribe exercise within the competencies for that role. So if you're working with people with comorbidities or at high risk of cardiac disease, respiratory disease, there's things that we need to be aware of. There's the benefits far outweigh the risks, but working with those people correctly is hugely important from a screening and monitoring point of view, and then also a motivational point of view to continue that adherence to exercise. That's EPMH. How's our health at the moment? So this is just a couple of general points I'm sure most of you will be pretty aware of. So there's a higher prevalence of serious physical health conditions in those suffering from mental illness. And as I just mentioned, some of those comorbidities that cause cardiac, respiratory, metabolic diseases. There's a huge disparity between general population and those suffering from mental illness, especially with those with severe mental illness. We know it's well documented now, but I always think it's worth mentioning that people with severe mental illness in England die on average 15 to 20 years earlier than general population, which is just an absolutely shocking stat that shouldn't be allowed, and we should be doing absolutely everything that we can to address that. And one of the things is that many of those deaths are down to physical ill health, especially cardiometabolic and respiratory diseases, we've said, which again at this time is a concern with COVID. We then, if we relate that, not just within mental health, but if we relate that to secure settings and PICU, we know that a lot of those comorbidities do become worse whilst in our care. When you look at just for obesity for starters, when you're looking at around 60% of the population are overweight or obese, and many studies show that when people are admitted to secure services, they're not too much over that. But 6 months into their stay, over 80% of people are overweight or obese. So that is something that we're doing within our services, and the restrictions on movement, that all adds up to that. And that is obviously a risk to many other diseases. And that leads into the physical inactivity and sedentary behaviour, which is a leading cause of death in developed countries. Many people are much more sedentary now, but again, within our services, within PICUs and secure settings, the nature of those environments is we're restricting people's movement and the ability to be active. So with all of those points, we really need to address that somehow as hard as it can be, but there are solutions and there are opportunities all the time. So one of those is physical activity. How do we introduce that? But just some of the benefits. There you can see by just regular exercise or regular physical activity. That doesn't have to be structured exercise. As long as you're keeping active, it's been shown that you can reduce your risk of developing a number of chronic conditions, and these are just a few of them, and the percentage you can reduce that by. And again, this is really well documented. We know all of these, so cardiovascular disease, we know in cardiac rehab, there's an exercise program. In diabetes prevention, there's an exercise program. Falls, depression, we always look at exercise, and so on. Cancer programs are bringing in much more exercise programs to that. And Chief Medical Officer stated if physical activity is a drug, we would refer it as a miracle cure. So there's lots of evidence and lots of backings to it, but we're still not really using it within mental health as much as we could do. Just moving into COVID. So we know some of the benefits of exercise, and at the moment we're being told that we can exercise more than once a day, which is great. And actually, I think this is the first time I can really remember all governments around the world being so proactive about getting people exercising and physically active, which is great. So you're exercising as much as you want within your household or with one other person from outside your household, and being the 2 meters apart. We all know that, we've heard it. And if we look out on the streets, it's great to see how many people have actually got active. Never knew there were so many budding Mo Farahs around, but it's great to see. And 63% of adults in England have said that the exercise has helped them with their mental health during this time. That was just a bit of research that Sport England released a couple of weeks ago. So the reason that we're being told to exercise and keep active during COVID, as we've already said, it can help manage our mental health, it can help manage our physical health, and can support our immune system, and also help support social interaction, even during social distancing. Just seeing people out and about. If you're, now that we're allowed to join in sport with someone else, just being able to see someone and interact with them is going to be a boost for us across all of those areas beforehand. So some of the challenges that I've heard from various services, and the guys go into this a bit more in a minute, so I'm going to really skip through this. But facilities wise, some services have got some great facilities exercise wise, but a lot of them have been shut down. We're not allowed access to them because of COVID and the worries about infection control. People aren't using the outside space as much as they were. Restricted space on the wards. We know they're quite tight and cramped, and depending how new your facility is, how big the people's rooms are, which causes a problem. And then even the lounges, is there room really to do physical activity with social distancing well, and any activities? Some places have reported as kind of a decreased importance placed on exercise. As you'll see, so some services have redeployed staff, which is absolutely fair enough. But actually, those exercise therapists that have been redeployed have been asked to do various different roles, which are kind of outside their competencies. But actually, we could be keeping people active on the wards through one-to-ones and raising physical activity again, as you'll see in a minute. So using that links into the staffing at the bottom, utilising people's skills whilst they're on your wards, make the most of it. They've got some great skills to get people exercising, motivated. There's increased sedentary behaviour because we're having to socially distance, and a lot of people are spending more time in the rooms. And on the wards, we've got quite a large population per metre squared on the floor, really. All of these challenges, they do link into opportunities. As I said, going back to the staffing and having the qualified exercise professionals on the ward, I think, as you'll see in a minute, but a number of services have said when they've been redeployed and allowed to do the exercise, they've had a massive change and uptake and an increase in motivation to want to exercise and do physical activity. Probably majority because of the situation that we're in, but let's really enhance and take that motivation in whilst we can. there's been a number of charity events, group and individual challenges that people could do to keep themselves motivated and give them some goals to try for. We could trial different activities at the moment and really canvass opinion. What do people want to do? What could we try at the moment? Collaborative work and staffing again, that just leads on to other members from the MDT, getting people involved in exercise. We need to look after our staff's well-being as well. So getting people involved in physical activity and exercise alongside our service users can really probably help build some rapport. Again, some examples of that coming. So just lastly from me, just thinking in and outside the box with how we perform physical activity and exercise. This has been shown across all sorts of things that we've seen across the general population, but we can implement that on our services depending on what we have access to. So whether it's, if you have the technology to be able to do online exercise groups, this is a dance group, making some dance up the top left, top right, doesn't matter how much room you've got, there's always something that you can do. In the smallest spaces, I think there was the cell workout on one of these webinars not too long ago, or on one of the group webinars, and just having a small space doesn't stop you from exercising. Think not just exercise, gardening, getting into nature, so important. Giving our service users the opportunity to do that where possible. Again, there'll be more examples of that. Walking, group exercises, we can do group exercise as long as we're keeping social distancing. And taking a leaf from Captain Tom here, just doing anything you can. Everyone can be active. A bit of walking goes a long way. So I'm just going to hand over now to Anthony from Cumbria, Northumberland, Tyne and Wear.
Thank you, Stephen. I'd like to start by just saying hello to everyone listening this afternoon, and also extending my thanks to Stephen for the invitation to present today, and also to extend that thanks to the Royal College of Psychiatrists for identifying physical activity as a topic for debate. It's a really important topic, and obviously I'm biased when I say that, but I don't think we can overemphasize that point. I'm going to give a brief overview of how the exercise therapy service for Cumbria, Northumberland, Tyne and Wear NHS Foundation Trust has adapted its pathway of care during COVID. But I would like to just start by bringing any of the attendees today, any of their attention to a CPD module that is available through the Royal College of Psychiatrists website. It was published by Dr. Mystery and Dr. Drummond, and it looks specifically at physical activity as an intervention within severe mental illness. A really useful guide and a really useful tool for other professionals to look at how they can have conversations with their service users, when they're looking to explore physical activities as a part of treatment. A publication that I've just seen actually come through this morning is from the Centre for Mental Health, and it's looking at the forecasted increase in mental health burden due to COVID, and once we're coming out of this COVID, and how the anticipation is that 500,000 more people may experience a mental health difficulty over the next year. So just touching on what Stephen's already said around the importance of physical activity from a physical health perspective, we can't ignore that. But equally, the wealth of research that is now becoming available around the importance of physical activity on our mental well-being. And as I've mentioned, the influence of COVID on people's mental health, it's really important that we're using physical activity as a tool to try and overcome that. I'm sure all of us as a nation, as a globe, are really experiencing the challenges of this COVID in one way or another. And as Stephen's touched on, there seems to be a great increase in the amount of physical activity in our local areas, which is a really positive thing and hopefully something that can continue. So just looking at exercise therapy's response to COVID-19, we have a well-established pathway that's been embedded for over 10 years now within acute admission services, including psychiatric intensive care. And we offer structured exercise interventions to help physical and mental well-being. Obviously, when COVID hit and the guidance and restrictions were placed on clinical activity, it had a huge impact on what we could deliver as a pathway. We had to close our department gyms. We were unable to function in the usual format where we would open our sessions to numerous wards across the hospital site, and leave was obviously restricted. We are, however, very lucky to have a forward-thinking management team who recognise the importance of maintaining levels of physical activity, and they were very supportive, ensuring that leave was prescribed in line with national guidance to ensure our service users had the opportunity to come and engage in line with the recommended changes that we'd proposed to the service. Our feeling that was, as leave was restricted solely to physical activity, obviously this government guideline, that physical activity was still something that could be maintained as part of our day-to-day practice. There would be a high demand within the service. So with that in mind, we decided to develop a new service model and just change our way of working ever so slightly. That meant we tailored our initial assessment process and made it a little more streamlined, so that we weren't going through the in-depth assessment that we would normally do, screening for any contraindications to exercise and ensuring that our care plans were specific. But we would go about that, and like as I've mentioned, in a slightly more streamlined way, and that would reduce the demand on our staff to fulfill assessment appointments, and would increase our team's capacity to engage patients in conversations around physical activity and provide more tailored one-to-one sessions. Another result of the COVID, from our perspective, is the improved links with Sunderland Foundation Light, which is something, I use that word improved, but we already had very strong links with the Foundation of Light, a very supportive network and very keen on promoting physical activity. And they approached us and asked us if we would like to be part of their 30-day fitness challenge, which involved us as exercise therapy staff demonstrating some exercise routines and then uploading them to our trust website, to the Foundation of Light YouTube channel, and just trying to incorporate and promote physical activity while obviously maintaining our social distancing. So that's been a really positive thing, and we can't overemphasize the importance and how lucky we are to have something like the Foundation of Light in place. It's really well attended and really well received, and was open to service users and staff. The next slide, if you don't mind, please, Stephen. Thank you. So a little bit about the challenges and the positive outcomes that have come with this. We established a new protocol for our gym use. So as I've mentioned, initially our department gyms were closed, and we were offering one-to-one sessions where possible. So we devised a plan to minimise the numbers of persons using and attending the department gym, so we could maintain social distancing while they were in our departments, and offer them on a ward-by-ward basis, looking at each ward effectively as a household. As I've mentioned, limiting numbers so we could maintain social distancing while they were in the department gym. Protocols were put in place where service users had to wash their hands prior to using the gym, after using the gym, and then also once that ward left the department, there was a deep clean performed, and then we were ready to offer the service to a new ward, effectively what we were deeming a new household in some respects. This protocol was agreed by the service managers and infection prevention control and our COVID-19 command team, and then it was put into place and implemented. As Stephen's already touched on, and I have also, we anticipated an increase in our uptake and engagement with exercise therapy, and that's come to pass. Our statistics show a 71% increase in April in the number of patients being assessed across the site and within psychiatric intensive care. On that note, psychiatric intensive care actually showed a 32% increase in engagement levels when compared to the 2 previous months. And we're actually seeing a huge improvement in the number of our service users who are now meeting their care plan, their exercise prescription, whatever that is, tailored for their individual needs. And going forward, we hope to implement some of the changes that have almost been enforced on us for the benefit of our service users. That's everything from me for the time being. Obviously, if there's any questions, we'll address those later, I'm sure.
Thank you, Anthony. I will hand over to Sofie.
Yeah. Hi, everyone. I'm Sofie. I work as a senior clinical exercise therapist at South West London and St George's Mental Health Hospital. I'm just going to go through a bit what we have done so far during the COVID-19 outbreak. So before the COVID-19 started, we are 2 clinical exercise therapists within the forensic service. We are covering 4 forensic wards. So we have 1 low secure male ward, 2 medium secure male wards, and 1 medium secure female ward. During that time, we had a timetable to fit in every ward for exercise from Mondays to Fridays, and we did gym sessions, sports sessions, community groups such as swimming and walk in the parks around London. We did health promotion groups, and we worked well together with the dietitian that covers the whole trust. We did health screens with all the patients before attending any exercise groups, and we did gym assessments with all the service users. When COVID-19 started, my colleague and I were allocated a ward each to avoid cross-contamination. We just happened to be allocated to a medium male ward each, and they closed the central therapy area from day 1, so we didn't have any access to a sports hall or to the gym, much as the rest of the therapies. So we were allocated to the wards to just work as much as we could with exercise on a social distance manners, but also helping the nurses and ward staff, if need be, to do any leave or covering the ward in general or doing any obs. For the 2 medium secure male wards, they have one big garden that they share on a timetable as well. So at the minute they get an hour a day to do exercise from Monday to Friday. So we use the garden as much as possible. The sports hall, even though it's been closed, it's been used solely by the female ward because their courtyard has been too small for them to do anything, and the ward is a bit, the layout of it is a bit awkward, so they have solely used the sports hall to have a bigger area to work in. So our exercise provision during this time. So the female ward, even though they have not had a qualified exercise professional during this time, the OT and activity worker on that ward have taken some of the patients on to the sports hall to do Zumba. So they've done a video projection on the big screens. Any patients that wasn't health screened before the COVID, any new patients, we did health screens over the phone. So we still knew that they had no contraindications or anything to exercise. They were safe to do that type of exercise. But the Zumba videos were also low intensity exercises to try to find those more low intensity because there were no qualified exercise professional around. Table tennis has been really big during this time. For the 2 male wards, they have had, before COVID, they had 1 table tennis table to share. But during this time, we took one from the sports hall and borrowed that to one of the wards, so they always had a table, and then all I had to do was just request for the bats and nets. It's been really good feedback from both patients and staff, and they love having the table there in the communal area. They had they do tournaments and competitions, and the guys love competitions. That's been a really good thing. We try to do as much as possible outside in the garden. As you can see in the photo, it's a bit bigger area on the timetable provided for those 2 wards. We've done exercise bingo, which is a good competition as well, so that's been well attended with social distancing, but also done 1-to-1 and 2-to-1 sessions, jogging around the court, done some bodyweight exercises, and also some patients that we know have done exercise in the rooms that have been safe to do so. It's been really good uptake, not just for the patients, but for staff who actually joined into our sessions as well. And because the central area has been closed from day one, we are now in the process of opening the gym. So we're doing risk assessment and thinking about where the equipment goes and keeping the social distancing, washing our hands before and after sessions and all that. So that's something we're really looking forward to now. So the patients are really asking for it. We have online resources. So the clinical exercise therapy team that covers the rest of the trust, they're not covering forensics, but they've done some great work now during this time. They have a gym on grounds that community patient and the rest of the inpatient wards attend to. But because community patients cannot come to this gym, they have started a YouTube channel where they post one video per week for the community patients, so they'll be able to reach them as well. And also for staff working from home. They also have a football team that have not been able to do any groups with, so they've done Zoom live sessions. And contrary to our gym in the forensics, their gym has been open from day one, but on a timetable for the other inpatient wards. So if you want some ideas of any exercise classes, or if you have internet connection on any of the PICU or forensic wards, just have a look at their website, because there's some good classes there. Beginners, martial arts, some stretches, squat exercises, body weight, seated classes and things like that. So it's a really good website. So our challenges and successes over this time period now, obviously just having 2 qualified exercise professionals, but 4 wards have been that we can only get specific exercise input to the 2 medium male wards that we have attended to. So the low, medium secure ward and the female ward, even though they have done other physical activity, so low levels, they haven't got the proper input from a qualified professional. Also notice that just being able to work on the ward, we've been lucky now with the good weather, being able to use the big garden for our 2 male wards, but during rainy weather, it's harder on the wards because there's not enough space. Our centre therapy area, as I said, has been closed from day one, so it's harder to do groups, and our guys have really enjoyed gym, so that's something we've been trying to change and do more bodyweight exercises in the garden. And obviously we have a lack of social inclusion, as we can't mix any of the wards at the moment. However, our attendance to our groups when we're outside is a really good attendance, and we're seeing service users that normally wouldn't attend any of our exercise sessions have actually started to engage in them. It's really nice to see. It's been easier for us me and my colleague to promote the exercise both to ward staff and to our patients and build that relationship, so it's easier to get them going with their goals as well. And seeing the ward staff joining in our sessions is great to see that togetherness on the wards. So that was all for me, and hopefully we have some questions afterwards that I can answer if you have any.
Great, thank you, Sophie. I'm going to hand over to Jack.
Hello everyone, I'm Jack Phillips and I'm from Langdon Hospital down in Devon. I'm just going to give you a quick brief overview of what we've been doing through the COVID situation. Stephen, if you can move to the next slide. So it's just important to point out that we do have a really big team. So we have been lucky during COVID to still be able to offer a lot of activity around site. We doubled our team in November. So in essence, we've got 8 of us now on the shop floor to cover our wards, which is really good. If we could just get to the next slide. Again, we're lucky being down in Devon. We've got a vast amount of land on site, so socially distancing ground walks and activities has been really beneficial for us. As you can see in the pictures as well, we have really big gym areas, so we have been able to keep these open. Obviously, we've had to do this really carefully with socially distanced measures in place for PPE, but we've been able to get hold of signage, which has made it really clear for our patients to use. So this was the timetable that we were able to offer pre-COVID. As you can see, there's quite a lot on there. Again, we're really lucky to be supported by our senior management team to be able to offer so much. But again, as the guidance come in and we had to pull away from this, it did open up a lot of anxieties for our patients that would be missing out on such regular activity. We were asked by the senior leadership team to come up with some phases because we're quite a big team. We needed to be available to support the wards however we could in case of people going off with sickness. So we came up with 4 phases. The first phase initially, before the guidance come out, was to stick to our current timetable. This didn't last very long at all. So we had to quickly move on to our next phases. Our phase 2 program is what we hope to start again on Monday. So again, we've got 2 big teams that we've had to split into. So we can have a team for our medium secure unit and a team for our low and open, just to avoid cross-working on the wards, but still being able to have enough cover to provide activity. We're going to, like others have mentioned, offer gym on a ward-to-ward basis. Again, seeing them as a household with deep cleans in between. If you look on the next slide, it's just visual from our timetable, how we're still going to offer ward sessions with our deep clean in between, but still get on the ward to offer activities as well, which has been really beneficial, especially during this time. What's important for us as well is because there's so many of us, we can plan a timetable and get this visually up for the patients so they can still keep the routine that they had already built as much as possible. On the next slide, our phase 3 is the one that we've been in for 2 months. This has worked really well. So we teamed up with the allied health professional group on site and made a big super rota, if you like. So each ward had 3 extra members of staff available to them. Obviously, their main purpose was to be there for their job role, and ours was physical activity. But if their staff group did job, we were expected to help out with ward duties. What's worked really well is the wards have been brilliant, and we can do these duties such as observations whilst carrying out physical activity, which has worked really well for everyone all round. What the rota did as well is to allow some people to work at home. So there was a bank of people to call upon should people be off sick or with leave, so we could come in and again offer more activity. Phase 4, we haven't got there yet, touch wood, but we would be on the wards as members of staff. So the next slide, this was kindly done by the Mental Health Improvement Network. It just summarises what we did in our phase 3. I just wanted to put it on there because I think in number 4, we just made the point of not underestimating physical activity. We've had so much positive feedback from our patients that it's been a real coping mechanism for them and a little bit of normality to still have that physical activity and that release. So again, we were very lucky that our senior management team were forward thinking and could see this, but if there are places out there that are not, I think trying to get proof and things like this will really help to see its worth. The next slide, we love keeping stats down here at Langdon. So in November, we've started to increase our level of engagement with patients. We keep a record of this on a month-to-month basis. So things are going really well, and then COVID hit, and you can see we took quite a dip when we were planning our phases. What initially we were surprised to see how much engagement we got during the COVID period. It's actually been one of our best results, best couple months, and more people we're seeing. Obviously, we've got to take into account leave restrictions and stuff being stopped, but it's given us a chance to reach those hard to engage patients, and we hope to be able to keep that going as we move forward now they're hooked and engaged, and we've built those relationships. The last bit for me, just to finish on some pros and cons of what worked with us. We found that when a member of staff was designated to a ward, it was only them that could facilitate the specialist sessions, being qualified to do certain rehabs. If they were not in, obviously the ward would miss out on these sessions, and it could increase a bit of anxiety of when are they going to get these sessions back. The loss of social benefits, as mentioned by others, has been huge. I think a lot of emphasis goes on the physical benefits of exercise, but especially down here, our guys love getting involved in big groups, and they have voiced how much they miss that. So we are looking forward to hopefully getting those going again soon. Again, with a big team, the way we worked, we fitted our qualifications and skill sets with certain patients, which worked really well. Obviously, we can't do that as much now, so our staff have become less familiar with certain patients, and relationships they've built are in danger of being lost for when we go back to normal. Really good positives though to come out of it. I think our relationship with the ward has increased massively, which is really good. They are seeing the importance a great deal more, and what we can offer and how we work. And I think that's really going to help going forward in promoting physical activity. Obviously, like a lot of places, we've had to adapt certain games and activities and exercises, but they've worked really well with our hard to engage patients and low level activity, which we will definitely keep going forward. And the final part, the best bit is we are achieving our aim finally of getting those hard to engage patients and keeping them engaged with us. But thank you for listening to me, and if you have any questions, please do ask at the end.
That's brilliant. Thanks, Jack. And then to pass you over to Gareth.
Hi everyone, can you hear me okay?
Yep, all good.
Cool. Right, I'm going to try and throw this out in 5 minutes for you, seeing as it's just being a push for time stuff. So I'll try and get all this bit in. What I'm going to do, I'm going to give you a bit of a how-to of a concept that we do called Mile a Day. We've been running this concept at MPFT for 2 years now. Steve, you can go to the next page if you want to. And we've just made some modifications to it, given the COVID restrictions. Like everyone else, we've had those, similar scenarios. Lockdowns meant lots of restrictions on physical activity. Myself and my physical activity team I work with, we were reassigned, and we made a point of resisting those reassignments and making a point of saying that we need to make sure that we're preparing for a post-COVID environment. But also something that, like a lot of people with their gyms, ours got shut down, but our gym and sports hall also got turned into an adapted COVID ward. So we're looking at a concept of saying we're not realistically going to see that come back this year. We're being told not to be that pessimistic, but we're saying more on a pragmatic point of view. Let's just look at finding a new normal so that we can prep our service users for what's going to be a more likely parity. So this is where Mile a Day came in for us. Like I said, we've been using this concept for 2 years. It's used more often than not as an initial engagement tool for those who are skeptical with exercise of any kind. We use it with our staff and other AHPs, such as the OTs. They basically run this more on a ward-to-ward basis. So it's heavily embedded in our program as standard. So we used the COVID lockdown environment to sort of look at how do we make this program more inclusive and fit in with at the time, current lockdown restrictions, but even now, using it in that way. I'm sure a lot of you who particularly work in secure services, you'll appreciate it's very difficult to get many of our service users even out of their rooms, sometimes in the best capacity. So Mile a Day was based on this concept of just get them out of their room and just do something at the very least at that base level. So this new one that we did, Mile a Day Coast to Coast, is what it was called. Incidentally, all the information you can go, yeah, Karen, go to it. All the images that you're seeing right now, the posters and this part now, it's all been created by our service users. So we gave them this concept of doing a 30-day step challenge, walking to John O'Groats and back, which works out to be 3.5 million steps. That's what we got it to. We wanted to make this more of a service-wide challenge instead of it being an individual competition. That's why we made it there and back. We've got 60 service users in our immediate site. So we wanted to make it realistic that they can all do it together, but you know, for those people who want to do more, they can. Putting an emphasis on individual effort to a bigger purpose. So like I said, 2,000 steps, 1 mile, and that's all we were asking everybody to do, 1 mile for 30 days. That would be the goal. So we gave everybody a pedometer, as in like all our service users. We gave some of the staff pedometers as well because they're taking part in it as well. And then people have just got onto it. It's 1,648 miles in total, just so you're aware, for those of you who might be asking. And with the 60, like I said, we've got 60 service users. We've got about 39 of them doing it at the minute. So we're really happy with those numbers. It fits in really well with the social distancing guidelines and the lockdown measures as well that were in place, particularly the strict ones when we started. What we were finding was that, again, like many of you, we were finding that the service users were coming out of their rooms more. They were engaging in this in a much more proactive way. Yeah, sometimes some people might, say, well, I'll only do a mile instead of their usual 2 or 3 miles they do. That was going to happen. We knew that was going to be a thing, but we put other things in place for them, to deal with that. You can head to the next page, Steve. So just to give you an idea of how far it is and there and back, this is the tracker sheet that one of our service users made for this challenge. So this is on every ward. We update this daily, just to see what's going on, and basically we just colour the dots in as we go up, and then we add a star on the way back down. I think we're just under 3 weeks into it right now, so we're on our way back from 4th Augustus, if I remember correctly. So that's where we're heading from at the minute. It's tracked individually as well. If you head to the next page, that's great. So we track this individually as well for some service users. This was theirs that they made themselves for this. It was really important for the service user input that they also recorded how they feel after the walk. Hopefully, once this is all done, relay some information about how they feel it's perceived on their mental health as well as their physical health, with what's going on with this. So what the idea was that in each box they would fill out how many steps they've done for each day or how far they travelled. But equally, on the opposite side, they'd also say like how they felt after their walk. It is being used in that way as well. It's quite fun when you're looking into, when you do see how some of the service users are doing. They are, they've got a number followed by a smiley face or a straight face. They use different emojis for different feelings as well. So it's been quite an interesting look on what they've been doing with that. But it's been really useful as a track for the trackers, both the ward-based one, the service-wide tracker, and the individual one, for monitoring how they're getting on. It's monitoring their levels of commitment as well, whether some people saw it just a novelty for a week or two, or whether they've actually engaged in, further into it or not. It's also been very useful as part of MDT and key worker conversations as well. Obviously, like many services, it's limited. We've had a lot of limited therapy time and intervention time across the sector and across the whole board. So this is one of those few activities that we've been able to continue to engage with and actually give them something to work with to assess people's progress throughout their time with us. So that's where we are with that one. Go to the next page, Steve. Again, certificate that they service users designed again. One of the big parts of this whole process, the Coast to Coast Challenge, was that we wanted to make sure that there was personal achievement in the bigger picture of working together. So every week we check how far people have done, and then what we look to do then is basically do 1 mile. We've got certificates for 1 mile, 5, 10, 20, 30, 50, 100 miles. the idea being really simple. We're monitoring this and we're rewarding that effort. It was really important that we have community parity with normal, what would be normal with these sorts of challenges. So if you think of things like the fun runs that people would do outside, and currently during lockdown, I'm sure some of you might have taken part in some of these virtual challenges. We wanted to make sure that our service users could see the advantages of doing these things. So we have done things like, do t-shirts and certificates for it. And it meant as well dealing with some of the adaptations, as you can see right now. So one of them being our ward bikes. So one of the things we had was ward bikes introduced to the wards about 3 days after we started this challenge. So the novelty of having a ward bike, but then doing this challenge was difficult. So what we had to do was we decided we were going to make an adaptation. If they do 20 minutes on a bike, they can contribute that to a mile to the challenge. Obviously a bike will go further in 20 minutes, but that was to make sure that people weren't taking advantage of using a bike. We set individual targets for those who were less able and motivated, because 2,000 steps might seem like a lot to some people, and it did. If you said you only need to do 2,000 steps, that concept was quite big. So we've set smaller targets for some people who are actually achieving more, but they just having those smaller targets in mind has given them the motivation to do it. And more importantly, those who have got actual physical needs, physical rehab needs that would typically exclude them from such challenges. An example I can give you with this one, we have a service user who's in a wheelchair. He can use his legs, but he's currently in strong rehab. So we're actually because we're using pedometers for everybody, we've actually decided to go that 1 rep of his physiotherapy exercises and his other exercises that he's doing contributes 1 step to the challenge. It's meant that he can be involved in it, and that's a big step. That's a big thing for us. Inclusion is a massive part of mental health and mental well-being, particularly in a group-wide, service-wide challenge. So it was just to show, really more than anything, with the Mile a Day Coast to Coast Challenge, that this is something that is really easy to do. Everybody can do something in terms of movement. And what we wanted to do was make sure that people could, work together, still have that sense of community with each other and have some responsibility while they're, while we're coping together during these times. And it's worked really well. Hopefully what we'll see, in future, I'll be able to actually pull out some statistics about how this has gone for us, and, let other people know what's going on in other trusts who adopted the challenge with us as well. So, that's it. Thanks for listening.
Brilliant. Thanks, Gareth. Sorry, I know I'm aware that we've let time get away with us, but I think hopefully those examples have been really helpful for you and kind of just shows how passionate people are about getting this physical activity and exercise going for our service users now and going forwards. I'm going to probably have to zip through these, but these are just a few more examples, which will obviously be on the recording, that you can have a look more in detail. But very similar experiences for people, but Matt War at Central and Northwest London on a PICU. They've come up with a couple of different ideas. Their garden space wasn't used, so they've done a kind of transformation of their garden. And then since then, one that's got people into the nature side of things, but they've also managed to convert that to be able to do sort of Joe Wicks type sessions, circuit sessions, keeping the social distancing, which is, as you can see, has been attended by staff and service users, and it's got people together. Some really great results that they've had, and from what Matt was telling me, the improvement in, again, uptake, motivation has been great, and they've also noticed a reduction in violence, and they're also putting a lot of education sessions around healthier lifestyles and linking that in with the gardening project and the growing your own plants and vegetables. Nottinghamshire Healthcare, so Rampton is high secure, but I think shows the type of things that can be done. I mean, Rampton have got some fantastic facilities, and James Roughton from there was saying that was being one of the main frustrations, that people couldn't use those facilities, but they've allocated people to each ward very much in the same way as you've heard, exercising with people, wearing PPE, which is a challenge in itself. But moving people around their units, but finding ways to do one-to-ones, be that in the gym or on the ward, has again really supported those service users. Oxley's, Mark Baker and his team at the Bracton Centre, they've been trying to keep things operational right from the beginning. Again, very supportive management team. It was kind of a business as usual approach, but obviously using PPE, social distancing. They limited their gym times to a ward for 45 minutes, and then there was always a cleaning during that session and then straight after the session, and wards were allocated times to be able to go. That's always with a exercise professional. Again, they had some good outdoor facilities, so they've used their meadow for walking challenges, much like Rampton did as well. And then Elisa from Leeds, they work on a PICU and then a lot of rehab and acute inpatients. They've been keeping things going with a one-to-one basis, allocating staff to the wards. But now they are looking to open their gym from this week, I think, which will be allocated half a day per ward. So again, there's the cleaning throughout. It'll be one-to-one in the gym, and then cleaning straight afterwards, and then a deep clean every night as well, and in between different wards attending. So sorry to zip through those people, but those and the guys that are presented now, I think it is fantastic to see the work and the adaptations that you've made to be able to keep that going. So just quickly to finish, we know there's a large evidence base for the exercise and physical activity, especially during COVID-19, for our mental health, our physical health. We've said about the qualified exercise professionals doing their role, which is really important, using their training and knowledge and working within your competencies, but actually it's everyone's role to keep people active and stop that sedentary time. It's such a massive, massive thing that we need to address, is stopping people being sedentary, even if we're getting up just very briefly every sort of half an hour, and just the minimal movement can make such a big difference. So really advise everyone to try and help support people to be active through their days. Like I said, allowing qualified exercise professionals to work with those with higher risk, and using their correct qualifications to do that within their competencies. We've seen that services have allocated exercise professionals on the ward. We've seen an uptake in physical activity and motivation to do that, which I think is a real opportunity now to develop that new culture that we spoke about. And just if you want more information, many of you that work in secure settings should have hopefully seen these managing a healthy weight in adult secure services guidelines that we helped with. But there's information in there around physical activity and exercise and types of things that can be done. And just very, very lastly, I'm not going to go through all of this, but my main takeaway message from this is a great opportunity to change our culture around physical activity and exercise in people's care. And we need to make sure that once we come through this, that now and going forwards, that's brought to the core of people's care. And that's just some of the other work there that we're doing as EPMH around guidance, standards and accreditation. Some resources for you there that you'll be able to see on the slides when you go back, but some resources at the bottom about how to get moving and some exercise opportunities, and then some research there as well for you. And again, just a massive, massive thank you for everyone that's joined in today and listened. Thank you to Royal College of Psychiatry for your support with our network and for inviting us today. And just again, a really big thank you to all those people that are keeping exercise and physical activity going within their services. You're doing a great job, and just keep it up. Thank you.
Great, thank you so much to all the speakers. Just to say to everyone listening that this is recorded and we'll be posting it on our website, so please keep your eye out for that. We've also got a number of webinars coming up, so we will be emailing out more information about that soon. All right, thanks everyone, and have a nice weekend.